Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and we're going to talk about parking that big Mack truck right in that tiny garage, to quote Megan Thee Stallion and Cardi B. But anyways, we're talking about adult cases where they're not growing, but they might already have spacing. And sometimes those are our easiest cases, right? But sometimes they're not, because you have to make sure that that big Mack truck fits in the tiny garage. So let's talk about this a little bit more. Why do we have adult spacing? Anytime you see adult spacing, you should ask the question why. There needs to be an answer before you know if you can close those spaces. So you got Bolton is your number one. That's really easy to find out. That's your occlusogram. You can get that on ClearCorrect, Invisalign. If you're thinking about braces, you should know how to measure your Bolton in your scanner or something just to see if there is a Bolton mismatch. It's always a great idea to know ahead of time before you try to slam those spaces closed or promise the patient you can slam the spaces closed. Because you could get a POB or an AOB, anterior open bite, posterior open bite, if you didn't realize that you had a Bolton. Especially a mandibular Bolton. Another reason could be microtrauma or pathologic tooth migration. Maybe a tooth just kind of moved out of the way to avoid traumatic occlusion and just created a space. So putting it back might put them back in traumatic occlusion. Again, assuming you articulated the case right and there was no shift. Sometimes there is shifts when you have this type of microtrauma or pathologic tooth migration or PTM. So check the bite and be on the lookout for shifts, because that should be a really big red flag there. Let's see. And, putting that tooth where it doesn't need to go could cause trauma or perio issues. In addition, you could have posterior bite collapse causing it. That can splaying, a tongue thrust, myo issues, or just your national soft tissue envelope needs to just needs to happen so everything has a space it needs to equilibrate. So these are all reasons why you might have some spaces on a patient. You should definitely check it out. Make sure you know a little bit something about myofunctional therapy before you know that you can close the space. All right, hopefully that helps. Thanks.